That's right, Shauna. After your devastating story, vaccines offer the best hope to end the suffering in long-term care. The provincial rollout of doses to vulnerable residents is taking a lot of criticism after a report finds that if the Ford government sped up the pace of vaccinations, hundreds of infections would be prevented and many lives saved. Currently, the government is aiming to vaccinate all long-term care residents in the province by February 15th. The report by the COVID-19 Science Advisory Table finds if it was accelerated by just 2 weeks to January 31st, it would prevent 600 cases and 115 deaths. Currently, roughly 56% of Ontario's 78,000 long-term care residents have been vaccinated. Compare that to Quebec, where 100% of its 40,000 residents have been vaccinated, and Alberta, where 100% of its 19,000 residents plus staff have been immunized. Critics say Ontario needs to pick up the pace.
Yeah, I think Ontario is doing a very poor job in its rollout. It is uncoordinated. It has not been prioritizing long-term care residents over acute care, and it has been stopping for holidays. Every time that we are taking a break or focusing on people who are not the most vulnerable, we're losing lives.
Now, Pfizer is reducing deliveries to Canada. Ontario was expecting 80,000 doses next week, but is now getting none, raising concerns the pace of vaccination could be reduced. The government says it's still trying to determine the impact. And concern has also been mounting that ICUs in Ontario are overwhelmed. There are currently 383 COVID patients in intensive care, above the 350 threshold that is straining hospitals. Today, the Prime Minister announced the federal government is sending help.
Our government is deploying 2 federal mobile health units to the GTA. This will provide up to 200 additional hospital beds and free up space for people who need ICU care.
When asked where the field hospitals will go, the Ford government told CityNews details are still being finalized. The federal government says the field hospitals will each have 100 beds and they will be staffed by the province.
They will provide additional hospital beds and facilitate the transfer of non-critical care patients out of critical care to ensure that these specialized resources are available for those who will need it the most.
The federal government said the mobile units were being sent after the province requested assistance and that they will be in the GTA as soon as possible and can remain until at least May 1st, depending on the COVID situation.